video, we shall be looking at the causes, treatment, and prevention of peptic ulcers. Peptic ulcers are basically common in most people around the world, and this is opportunity to understand what causes peptic ulcers, how do we treat it, and then how do we prevent it from happening in our bodies. So, what do you understand by peptic ulcers? Peptic ulcers are simply sores found in the lining of the stomach, the upper portion of the small intestine, or the lining of the esophagus that can cause moderate to severe pain. You could have realized this or felt moderate to severe pain, and this basically affects the lining of the stomach, the upper portion of the small intestine, or the lining of the esophagus. And it is pain, it's moderate to severe. So in the diagram you could see like what peptic ulcers can do. So we have different types of peptic ulcers, and the first type is the gastric ulcers. Gastric ulcers occur inside the stomach, as you can see in this photo. It's happening in the lining of your stomach. And then we have the esophageal ulcers, which basically happens within the esophagus. We call it the gut, the gut. And then the third type of peptic ulcers is called the duodenal ulcers. Here, so the duodenal ulcers occur inside the upper portion of the small intestines. So how will you know that you're either suffering from one of these types of peptic ulcers? So here we are going to look at the symptoms and signs of peptic ulcers. So burning pain is the most common symptoms of peptic ulcer. The ulcer is often aggravated by stomach acid coming into contact with the ulcerated area. The pain can typically occur anywhere from your navel up to your breastbone. You feel worse when your stomach is empty, and sometimes you feel worse at night. You will temporarily be relieved after eating certain foods that buffer the stomach acid by taking an acid reducing medication. It disappears and then returns again. Less often, ulcers may cause severe symptoms and signs like vomiting of black or red blood, dark blood in the stool, nausea and vomiting, unexplained weight loss, and appetite changes. So those are some of the signs and symptoms you need to watch out. If you experience any of them, then one of the likely suspects could be the peptic ulcers. So what causes peptic ulcers? Peptic ulcers can be caused by a variety of factors, though many believe ulcers can be caused by spicy food or stressful job. This is simply a myth. Peptic ulcers are actually caused by a bacterium. So a bacterium is basically an infection of bacteria called Helicobacter pylori. This can cause ulcers to develop. It is found in the mucus layer that protects the tissue that line the stomach and the small intestine. This bacteria can cause inflammation of the stomach inner layer, resulting into ulcers. Pylori has been found to be passed from person to person, or from food, or through food and water. So The second cause of ulcers is basically the regular use of certain pain medication. Some pain relievers, including aspirin and ibuprofen, can irritate or inflame the lining of the stomach and small intestines, resulting into ulcers. Then the third cause of peptic ulcers, the use of other medications. So medications used to treat osteoporosis can cause called bisphosphonates, and potassium supplements can lead to ulcers. So keep in mind that smoking and drinking alcohol can also make your body more prone to developing ulcers by irritating the stomach and decreasing your immunity. So when you get infected with ulcers, how can we go about in treatment of these ulcers? If peptic ulcers is not treated, they can lead to serious health problems. Depending on the cause and severity of your peptic ulcers, there are a few different treatment options that can be administered by a health professional. One is lifestyle adjustments. Limiting or eliminating alcohol and smoking from your life can help to reduce irritations to the ulcer. Secondly, medication. Depending on your case, proton pump inhibitors and antibiotics can help treat ulcers. Proton pump inhibitors help reduce acid levels, and antibiotics help treat the pylori infections. Then the third treatment method is a surgical procedure. If the ulcer has created a hole in the wall of the stomach, surgical operations may be necessary. Minimal bleeding caused by peptic ulcer can also be treated with an upper endoscopy. How do we prevent peptic ulcers? Reduce your risk of developing peptic ulcers by 1. Avoid tobacco products. Avoid alcohol. Use caution with aspirin. Don't ignore your ulcer symptoms, and protect yourself from infections by washing hands regularly and consuming foods that have been cooked thoroughly. I believe this video will help you understand the causes of ulcers, treat the ulcers if in case you get infected, and also the best way is prevention is better than cure. Let's try to if you prevent, adopt the prevention measures, automatically the ulcers will not infect you. Thank you and have a good day.